So we're going to start in Savasana, but we have two sequences here. Here, Laura is going to be doing a sequence for somebody who had just gone through surgery, so it's post. Michelle, we're going to be doing a modified variation of the sequence because Michelle is going to be a person who's going through chemo right now, or radiation, or. They're very similar. We're just using more props with Michelle. So we're going to start in Savasana. I'm going to have Laura lay slowly down on her back. She's going to bring her knees up, open them to the side. Bring your feet a little further out. Here, or here, or down. Perfect. Then she's going to bring her arms up, shoulder width, aligned with her shoulder, into a pose we call cactus pose. Then she's just going to allow herself to melt into the pose, breathing, taking deep breaths. I know it's hard to take deep breaths in this pose, especially after surgery. Our breaths are very shallow, but it's important that we train our bodies back into breathing deeply. This is a hard pose for post because you're opening up your chest. And a lot of us who have gone through this tend to close this area up, and we're very protective of it. So this pose really allows you to start opening up slowly. When I was going through chemo and radiation, I couldn't do this. So I had to have support in every pose that I did. I used sofa cushions, actually, or pillows. If you use pillows, you're probably going to have to use more than one. Open your knees to the side. And just keep your hands down here. This is a Savasana for somebody who's going through treatment. The props for a person going through treatment, props meaning pillows, blankets, whatever you choose to use, allow more comfort, because when you're going through treatment, everything hurts. Your muscles, your skin, your bones. It's very uncomfortable to do anything. And what the pillows can do is kind of massage you in the pose. I loved doing yoga while I was going through treatment. After was the most difficult time for me because it was so painful, and I was so angry at my body and what it looked like, and it was hard. So these poses that I'm showing you here got me through my treatment. You can modify it to get you through yours. Each pose should be held about 4 to 5 minutes. It all depends on where you're at with yourself. From here, we're going to go into a half bridge. So we're going to bring our feet closer to our butt. Ideally, you should be able to grab onto your ankles here, but if you can't, just having your hands close to your feet will do. And we're going to start raising our pelvic up, bringing our chest closer, as close as possible to our chin. Now, this is a very difficult pose for somebody in post because it's a pose that's painful emotionally and physically. The best, I guess, I can describe for you is try to imagine somebody here who has stitches on their chest right now and doing this pose. It's painful. I couldn't get myself up to this position for about a couple of months. It took me close to 3 months to get myself into half bridge. I would have to hold it and come down right away, and then probably practice it 3 or 4 times before I can hold it at all. It's a very angry pose for me, but it also gave me strength. It motivated me to get through this. So I'm going to leave Laura there for a few seconds. Hopefully she won't faint on me. Michelle, I need you to come up. For somebody who's in treatment, that's almost impossible to do unless you're a very physical person and you have the strength to do it. I wouldn't recommend it. I honestly was very kind to my body when I was in treatment, so I limited a lot of my exercises. But to get into half bridge for someone who's in treatment, you can take a towel or a pillow, whatever you have, roll it up. Towel works best. Place it behind you and then slowly come back down. And that was it for me. I wouldn't lift. I would just lay here. Having this here, it's already giving you the bridge support. Okay, Laura, you can come down slowly. Again, I don't mean to emphasize this too much here, but after surgery was the most difficult time for me to do anything, and every pose had a lesson for me, I should say. After I would do bridge, I would bring my knees into my chest and just hug myself and usually go into tears at this point because I was ashamed of what was going on here, which is a battle we all face when we're battling cancer. Then I just allow you to unlock, bring your feet down. Slowly come up into a seated position. We're going to come into something called Hero. And in Hero, I actually have these at home, but if you don't have these, you can do towels again or a pillow and try to make it narrow. Once in Hero, you're going to raise your arms up without moving your waist. You're going to start to turn from side to side, just your upper chest. And here, what this pose helped me with is when you're after surgery, your skin is very tight, your muscles are tense, everything is contracted. And this pose is actually helping to loosen up the skin a little bit and the muscle, and it makes your recovery and healing process much more quicker and less painful. Forgetting not to breathe also while in this pose. Michelle, just sit up slowly. Now for someone like Michelle, again, the pillows are huge. Hugely important for us here at this time. So you're going to kind of sit on it like you're riding a horse. Bringing your knees down. Bringing your arms up. And again, we're going to just move from the chest up, trying not to move the waist. We're going to go from side to side a little quicker. You can do about 10 to 15 reps. I would take it a little longer sometimes. It all depends on the day for you and how you feel. Yeah, I watch these girls and I can see myself during both times, and it almost brings tears to my eyes because I can't believe I'm here. You know, a lot of people tell you you can't do anything during or after. You feel defeated. But when you find things like this, you kind of feel alleviated to know that you can do it. You can do anything you put your mind to it. I won't lie, for a long time I even had my mirrors covered because I couldn't see myself doing this. I was angry at what was happening to my body, angry at what was happening to my life because of this horrific disease. Right? But slowly, as I kept doing these poses, I started to love myself again and love my process. We're going to go into a lunge from here. Now, some of us, come back down, yeah, some of us are a little masochist, and we try to push ourselves to where we shouldn't push ourselves, because you may hurt yourself. I suggest taking your time, being kind to your body, remembering that after treatment, your body is still sore, you're still trying to heal internally, so put some padding wherever you feel like you need it when you're getting into these poses. Michelle, slowly come out, lower your arms, come out to the side. Yeah. For Michelle, the more pillows, the better, because it's more about comfort level here and not hurting yourself. When I was doing these poses, I couldn't at this point raise my arms. The normal lunge, you would have your arms up. Can you just raise them just to show what it would look like? This would be a normal lunge. I couldn't do that yet. So having your arms to the side is just as fine. You can bring them back down. I did this for about 2 months before I could even start raising my arms up high. And with Laura, it was the same thing. After surgery, it's hard for you to have movement up here. So having something to lean your hands on is very important. Did you switch sides? Michelle, switch sides, keeping your hands on the bolster. So try to bring it up, yep. As you can see, when she just switched sides, everything looks so easy, right? Because they look like simple poses. But those of you who are going through treatment and watching this video know that even switching a leg is the most painful thing you can possibly go through at certain times. And once you get accustomed to doing it and you start seeing the difference in your body where you just smooth into it, it's pride. You feel pride and joy. Right? I'm going to leave you there for a few seconds. Laura, I need you to come into a warrior two. Easy transition for Laura because she has no props to really support her. With Laura, at this point, I didn't put any props because I needed to regain my strength. And as you can see, being here, she's trying to regain her strength back in her legs, which is something that we lose a lot because of when you're going through chemo and radiation, it burns into you, it weakens your bones, it brittles you, it allows you to feel weak. And warrior was one of my favorite poses because it would make me feel strong again. Right? Michelle, come out of it and step outside of the mat. For Michelle, that pose was too difficult for me when I was in treatment, so I would actually use a chair, placing a towel or blanket to make it comfortable. And then sitting, facing forward, I would just bring my leg out to the side. And this is a pose when I was in treatment that I did very slowly because it was more meditational for me, trying to understand my body, trying to forgive the pain that you were feeling. But having the support of the chair really, really helps. And it gives you confidence in accomplishing the pose as well. You know, some people try to go out there and go to a gym and try to lift weights. I've seen that happen with some women. You're hurting yourself more than you would ever need to. So I think yoga for me was what got me through my treatment. And I think it would help so many of you women out there if you just gave it a chance. Okay. Laura, I want you to swing your arms down. You come into child's pose. And as you saw, Laura, we do the poses on both legs. This pose for me, I loved because at this point I was probably in a bucket of tears, and coming into child's pose allowed me to feel, to let it loose. Turn to the other side to do the other side of the leg. So as you can see, you don't even have to get off of the chair. You can transition into the other side and just melt. And at the beginning, you may not even use the chair. Her body may have been lifted completely where she's not on it, but the chair is there just in case you can't support yourself. And you shouldn't try to support yourself at this point. You should be kind to your body. You go into so much when you're in treatment that it's only fair. Right? Now slowly come out of it, and we're going to go into a child's pose. Now, child's pose for when I was in treatment was a little different. Get into it, but I want you to lean your chest over your knees on the outside of the bolster, and then go into your child's pose. This was best for me when I was in treatment. I couldn't come down all the way that way. The support of the pillow is kind of soothing. It's soothing for your skin, for your muscles. It's amazing the feeling that you get when you start using props when you're in treatment. I've seen ladies do it without, and then when I tell them, why don't you try to use some support with a bolster or a pillow, they don't want to do it again without it. So I guess it's preference. Here, you can stay 4 to 5 minutes as well, or as long as you need. And then you're going to come into Savasana. But Savasana here is going to be a little different. Michelle, come on up. Savasana here for both during and post, for me, was the best. And it was the same. For this Savasana, we're going to go into a pose called Baddha Konasana, and you're going to bind yourself with a belt, a rope, whatever you have. Just be creative with it. And you're going to bring this over your waist. You're going to bring your feet into a diamond shape. And you're going to bind. Remembering not to, if you're claustrophobic, be mindful of how tight you make this, because it may be really uncomfortable for a person who doesn't like to be constricted. Here, we're going to make sure that we have support on all open areas. And then slowly lay down. Your arms, everything should be lifted off the ground. The best part of this pose are these little eye pillows. You can make them yourself. Somebody had told me how to make them. I went and got some buckwheat over at Whole Foods, some material, sewed a little pillow together, and I got some essential oils, lavender, and a little bit of eucalyptus actually. Rubbed it on and just placed this over my eyes. And put your feet into a diamond shape. And your arms out. Lay back. Remembering to breathe deeply, long, deep breaths. If you have some music at this point playing in the background, it's also beautiful. In this pose, I can honestly tell you I would probably last half an hour or more, or until somebody came and woke me up. It is such an relieving pose. It's a beautiful pose. Your chest is open, but you don't even realize it because you're so relaxed. These are the poses that helped me when I was going through treatment and after surgery. I hope that these poses can help you ladies out there as well. Namaste.